Good evening. I'm Kelly Collins, and tonight I'm going to be talking to you about methicillin-resistant Staphylococcus aureus, or commonly referred to as MRSA. MRSA is a fairly new emergent disease and causes disease all over the world, from common skin infections to more severe and fatal diseases. MRSA originated from Streptococcus aureus, which is a bacterium found on the skin and is part of the normal flora. MRSA cannot invade intact skin, and so to cause infection, the skin must be broken by abrasions, cuts, or scratches. MRSA is transmitted by direct contact and can survive on surfaces from hours to even months. Drug resistance is the cause of MRSA. By overuse and abuse of antibiotics, the bacteria was able to adapt and become resistant. The ultimatum of drug resistance is that one day MRSA will be resistant to all available antibiotics, resulting in no treatment and no cure. Scary. In the beginning, penicillin was the drug of choice for staph or Streptococcus aureus infections. Due to widespread use, penicillin-resistant strands emerged in the 1940s and became pandemic in the 1950s and early 1960s. In 1959, decreased staph infections were due to the introduction of methicillin. However, only 2 years later, methicillin-resistant strands emerged. Today, MRSA is a major cause of nosocomial infections worldwide. Nosocomial infections occur in hospitals because patients are already immunosuppressed and more likely to develop bed sores and other types of skin openings. This allows an excellent portal of entry for MRSA. MRSA has also emerged into the community and is able to cause infections in healthy people, and this is known as community-acquired MRSA. It's a mystery why community-acquired MRSA has entered into the community, because healthy people aren't under the relatively high selective pressures exerted by antibiotics like the hospital setting. Community-acquired MRSA was first reported in the 1990s in Western Australia and has since then became epidemic worldwide. And like MRSA, community-acquired MRSA can cause several fatal diseases. So how do you recognize MRSA? The infection may appear as bumps, spider bites, sores, or boils. Signs of possible MRSA infections include red appearance, swollen area, painful, warm to the touch, filled with drainage, and if fever accompanies any of these symptoms, you need to seek medical attention at once. So how do you treat MRSA? The best treatment for MRSA is prevention by good hand washing. Almost all MRSA skin infections can be treated by drainage of pus with or without antibiotics. Currently, the antibiotics of choice, and that it hasn't become resistant to, are vancomycin and linezolid. However, vancomycin resistant strands are now emerging, and so few drugs are left to treat MRSA. Prognosis for MRSA is generally good with antibiotic treatment and proper wound care. However, resistant strands have increased association with morbidity and mortality rates. With a 20% mortality rate, invasive MRSA is the leading cause of death by any single pathogen in the United States. Visceral abscess, osteomyelitis, and sepsis are illnesses that are potentially fatal and are caused by MRSA. The highest mortality rates occur in those that are 65 years or older and are higher among African Americans. The Center of Disease Control has termed 5 settings in which MRSA and community-acquired MRSA are more likely to be transmitted. They are referred to as the 5 C's. The first one is crowding, or areas of high traffic. The second is contact and frequent skin-to-skin contact activities, mostly seen in sports. The third is compromised skin, or cuts, abrasions, or scratches, and various skin traumas. The fourth is contamination and contact with contaminated skin and items. And lastly, cleanliness of items and surfaces. The 5 C's are most commonly occur in schools, dorms, daycare centers, military barracks, correction facilities, and households. Community-acquired MRSA may spread more easily among athletes because of frequent skin-to-skin contact, and they are more prone to breaks or cuts in the skin. Infection can also occur from sharing equipment and coming into contact with items that have had direct contact with the infected individual's infection site. Primary prevention for MRSA is good personal hygiene and taking care of the skin. If you have a scratch or an opening, cover it with a bandage and beware of signs of infection. Secondary prevention is early detection of MRSA and medical treatment used to decrease chances of severe infection. Cover the infection with a bandage to prevent spread to others. Wash your hands frequently. And do not treat yourself by picking or popping sores. Do not do that. Tertiary prevention is medical treatment for infected areas, including antibiotics, wound care, and education on keeping the infection site covered to prevent spread. Based on the disablement model, impairments for MRSA may decrease range of motion in infected areas. Functional limitations that patients may exhibit are unable to perform activities of daily living. And disabilities may be that the person cannot work at their desk job because of MRSA infections on their hands, and they are unable to use their keyboard because of decreased range of motion in their fingers. That would make the job hard. Physical therapy can help these patients by proper wound care and educating patients on prevention of contaminating others. Treatment may include whirlpool, wound packing, wound dressing, and education. Physical therapists should observe standard precautions and wash their hands frequently with soap and water. And wash their hands before and after each treatment session to prevent spread to the patients. And if a physical therapist had a cut or a scratch on them, they need to cover it with a bandage to prevent contamination of them and just prevent the whole chain. So, by taking the appropriate steps, MRSA can be maintained and produce little harm to patients. And remember, hand washing is the best way to prevent MRSA. Thank you. Have a good night.